Good thing about hair removal, it's gotten very fast, and if you do it right, no disposable. I ran my hair removal business with a Candela GentleMax Pro for about a decade, but I spent about 20 grand a year on cryogen. Now I can get better hair removal with a device that never breaks down. I get 3 wavelengths, not 2, and I don't have any cryogen disposable because I have direct contact. But one thing you want to be able to offer is small zone hair removal or whole body hair removal packages affordably. You don't want to battle the trichologist and the esthetician who charges like 20 bucks for an armpit. I want to offer 3-session whole body hair removal done in 40 minutes for 3 grand. That's a big market. That's high speed, effective hair removal program approach to pricing. And so skin type 1 through skin type 6, not tanned people, and guys. Guys are a big part of our hair removal program. About 30% of all our hair removal is now guys. And it used to be non-heterosexual guys. Now it's all guys. So young XYZers, they want to be pouty Calvin Klein, Justin Bieber models with tattoos and no hair. It's a big market. Weird, but a big market. And so you've got La Mecca, you've got the Morpheus, you've got the Forma, but you also have excellent 3-wavelength hair removal options inside your Optimus Max. And so let's take a look at the Diolaze. Let's take a look at the applicator. Okay, so let's put it on the screen. Shelby, you got to move it around. Don't get him to move around. Okay, you want him to move around. Perfect. Now, point to the pre-cooling plate. That's the post, the pre-cooling plate. There's the pre-cooling plate. It is dynamically cooled to about 5 or 6 degrees. You slide and glide at about 1 to 2 centimeters per second, depending on your pulse rate. You pre-cool, you cool while you fire, and you post-cool. Why is that important? I don't use topical anesthetic cream anymore. Don't need it. A very strong dynamic cooling. It does mean you don't have the same epidermal reaction. You don't have the same erythema, edema. You still have the smell of burnt hair, carbonaceous discharge, but you don't have the same little wheel of edema because it's dynamic cooling, which is okay. What do I use as my endpoint when I do a test spot? I want them to feel about a 3 or 4 in discomfort. Then I know I'm getting enough hair down to the bulb. I get ejection of the hair shaft. When I clean up my gel, all those little hair shafts are in the gel. You want to shave to about 1 millimeter in the clinic. Of course, they can't remove the target, which is the hair shaft, so don't wax, 3 weeks before you come in or we have no target. You don't also have to come in like with your armpit braided in a Fu Manchu. So have it just enough so we can see it. We shave to a stubble, we do a test spot, 3 or 4 out of 10 on discomfort, then do the whole area. Entire leg in about 12 to 14 minutes, half a leg in about 10 minutes, entire male chest in about 15, entire back in about 20 minutes. We can offer total hair removal in about 45 minutes, total body hair removal.